Welcome back everyone. In this section we delve into the heart of our discussion today, the VTE prevention policy. This policy is not just a document, it's a roadmap to safer patient care, a strategy designed to combat venous thromboembolism within our hospital. Let's start by understanding the purpose of this policy. It aims to ensure that all patients admitted to our hospital receive the highest standard of care consistent with the latest international guidelines on VTE prevention. This policy is our commitment to safeguarding our patients against the risk of VTE, significantly improving their hospital experience and outcomes. Now let's move to the scope of the policy. The scope of this policy is comprehensive. It encompasses all healthcare professionals involved in a patient care within our hospital, from physicians to nurses, from pharmacists to the administrative staff. Everyone plays a crucial role in this policy. Patient groups governed by the policy. Our focus is on adult patients, those 18 years and older, who are admitted as inpatients, including those here for surgery, medical treatment, trauma care, and long-term rehabilitation. It's our duty to assess, monitor, and manage the risk for VTE from admission to discharge. Now let's talk about groups not covered under this policy. It's important to note who this policy doesn't cover. Patients under 18. Also patients tending as outpatients or emergency department cases not admitted to our hospital, and the elderly or immobile cared for outside the hospital. This distinction ensures our resources and efforts are directed where the risk and impact of VTE are most significant. The importance of following international guidelines. Adhering to international VTE guidelines and standards is not just about compliance. It's about elevating our care to global best practice. These guidelines are based on extensive research and evidence, providing us with a framework to prevent VTE effectively. So it's about effectiveness of our care provided to the patient. Also, the Central Board for Accreditation of Healthcare Institutions, or CBAHI, sets standards that align with our goals for VTE prevention. These standards are not just benchmarks but are integral to our continuous improvement in patient safety and care quality. In summary, this policy is our blueprint for action. It guides us in identifying those at risk, implementing preventive measures, and ensuring every patient's safety from VTE. As healthcare professionals, our adherence to this policy is not optional. It's essential, a core part of our commitment to patient care. Thank you for joining us. Let's move to the next part of the policy.